This time I'm pulling the current across to ensure patient has privacy. Hello, Mr. Niles. My name is Jack. I'll be your nurse today.
Hi, nice to meet you.
Nice to meet you. I'll be conducting an assessment of your cardiac, respiratory, and abdominal.
Okay.
I'm going to start first by asking you some questions. Do you have any past cardiac problems, such as like heart problems?
No, I don't.
Any like past respiratory problems, such as like lung problems?
No.
Any past abdominal problems?
No.
Okay. Do you have any past like cardiac surgery?
No.
How about respiratory?
Nope. I haven't had any surgery.
No abdominal either?
No.
Okay. Do you have any like family history of cardiac problems?
Not that I can think of, no.
How about respiratory?
No.
Abdominal?
Nope.
Okay. Do you smoke at all?
No, I don't.
Do you vape?
Nope.
Do you drink any alcohol?
A little bit here and there?
Okay. Do you use any illegal drugs?
No.
Okay. Have you noticed any cough lately?
No, I haven't.
Any shortness of breath?
Nope.
Any chest pain?
Nope.
Any edema or swelling?
No.
Any abdominal pain?
No.
Any nausea or vomiting?
No.
Okay. Can you please state your age for me?
25.
Okay. What gender do you identify with?
Male.
Okay. Can you please state your first and last name?
Ronald Niles.
Okay. Do you know where you're at?
Doctor's office.
Do you know the date today?
October 26, 2020.
And do you know why you're here?
Just a general checkup.
Okay. I'm standing with Mr. Niles. He appears at stated age, identifies with the male gender, and he's alert and oriented times 4. Okay. His skin tone appears to be white. He appears symmetrical on both sides. His facial expression is calm and neutral. His speech is very clear. He's appropriately dressed for the assessment. His hygiene is good. Mr. Niles, is there any physical deformity that I should be aware of?
Nope.
All right, excellent. Let's move on. Go on to posterior chest. Please sit like this.
Okay.
Okay, I'll start with an inspection. The skin color appears to be white. I'm not noticing any lesions, and he appears to be symmetrical on both sides. I'll next move on to palpation with temperature. Appears to have a cool temperature. I'll now check for any tenderness. Any tenderness?
No.
How about now?
Nope.
How about now?
No.
How about now?
No.
All right, excellent. I will now check for symmetrical expansion. Can you please breathe in for me? Breathe out. Okay. He appears to have symmetrical expansion. So now, can you please cross your arms across your chest like this? Excellent. When I put the stethoscope on you, can you please take a deep breath through your mouth?
Yes.
All right, thank you. We'll auscultate. Okay, I'm not noticing any abnormal breathing or respiratory issues. Mr. Niles, can you please face this way? I will now move on to the neck, and I'll be palpating the carotid artery. Okay, the rhythm is regular. The strength is about a grade 3. Next I'll move it onto the anterior thorax. I'll start by inspection. you please sit up for me? Thank you. The coastal angle appears to be about 90 degrees. The AP diameter to the transverse diameter is a 2-to-1 ratio. The skin color is white and the condition looks good. So Niles, can you please take a deep breath in for me and out? One more time. Okay. Looks like he's having quality of respirations, and I'm seeing no accessory muscle groups involved in breathing. Next I will palpate. I'll start off with temperature. Temperature appears to be a little warm. Next I will palpate for tenderness. Any tenderness?
No.
Any tenderness?
Nope.
How about now?
No.
Any tenderness?
No.
Okay, excellent. Next I will auscultate. When I place a stethoscope on you, please take a deep breath in and then out. Okay? One more time. Okay. I'm not noticing any abnormal breathing problems. Alright, next I will move on to the heart. First, I will clean my diaphragm. I'll be starting off by using the diaphragm. I'll be looking for S1 and S2 sounds. I will be applying firm pressure, and I'll be listening for high-pitched sounds as well. I will start with the aortic valve in the second intercostal space. Moving on to the pulmonic valve, the second intercostal space, left of the sternum. I'll be going on to the tricuspid valve, the fourth intercostal space. And the mitral valve in the fifth intercostal space. Okay. I'll be doing the same thing again. However, because I have a belt cover, I'll be using the diaphragm again. This time I'll be checking for a heart murmur. I'll be using the diaphragm though with light pressure and listening for low frequent sounds. After examining the patient during my first time, I did not notice any adventurous sounds. S1 and S2 were present, and the rhythm was regular. Going to aortic valve, and the second intercostal space. Moving on the pulmonic valve, in the second intercostal space. Moving the tricuspid valve in the fourth intercostal space. Now going to the mitral valve in the fifth intercostal space. After listening again to the aortic, pulmonic, tricuspid, and mitral valve, there were no adventurous sounds, and I did not hear any murmurs. All right, next we move on to the abdominal.
Okay.
Mr. Niles, can you please lay down that way?
Yep.
Okay. We'll start off first by inspection. The contour appears to be flat, appears to be symmetrical. The umbilicus appears to be midline and directed inward. Next I will auscultate, starting in the right lower quadrant. Going at a V shape, 3 times in each quadrant. Next I'll move it up to the right upper quadrant, going in a V shape again in 3 different spots. Next I'll go to the left upper quadrant, going in a V direction in 3 different spots. And finally the left lower quadrant, going in a V direction in 3 different spots. After auscultating, there were vowel sounds present in each 4 quadrants. Next, I will go on the palpation, going in a V direction in 3 different spots, starting with the right lower quadrant. Going in the right upper quadrant, going in a V direction in 3 different spots. Going to the left upper quadrant, going in a V direction in 3 different spots. In the left lower quadrant, going in a V direction in 3 different spots. Alright, after percussing, all 4 quadrants appear to be tympanic. Alright, next I will go on to palpation, starting with soft palpation first, in the right lower quadrant, going in a V direction in 3 different spots. Any pain or tenderness when I do this?
No.
Going in the right upper quadrant, going in a V direction in 3 different spots. Any pain and tenderness when I do this?
No.
Going left upper quadrant, going in a V direction in 3 different spots. Any pain or tenderness?
No.
How about now?
No.
Left lower quadrant, going in a V direction in 3 different spots. Any pain or tenderness?
No.
How about now?
No.
Alright, next I'll move on to hard palpation. Any pain or tenderness?
No.
How about now?
No.
How about now?
No.
Go in the right upper quadrant. Any pain or tenderness?
Nothing.
How about now?
No.
Going left upper quadrant. Any pain or tenderness?
No.
How about now?
No.
Any now?
No.
Left lower quadrant. Any pain or tenderness?
No.
Okay. How about now?
No.
How about now? Okay. After palpating, I have not found any masses and the patient has not reported any tenderness. All right, Mr. Niles. That concludes our health assessment. I'd like to thank you for your time.
All right, thank you.
Thank you.
Have a good day.